What's up YouTube, Ad from C1 Do 1, here today with my first impressions about my psychiatry rotation. So, let's go. So I have to be honest, I actually was going to make a first day, first impressions video yesterday, my first day of psychiatry, and I forgot to put the SD card in the camera. So today's day 2, but that's okay because I have hopefully a better picture about what psychiatry is kind of like. The rotation I'm doing actually deals with what's called SMI, and that SMI stands for seriously mentally ill. So this patient population has a lot of schizophrenia, bipolar, major depression, psychosis, suicidality, everything that goes along with the serious mental illnesses that require closer monitoring and also a more integrative team that involves the medicine side and the behavioral health side. That's the rotation that I'm doing. So this is only my second rotation. Last month was family medicine, and this month is psychiatry. So I don't have a whole lot of experience, but I do kind of have some insight into, I don't know, the general gist of how to take a history and get some information from patients. I kind of didn't know what to expect because the only psychiatry exposure I've had previously was when I worked with Alzheimer's patients, and there it was geriatric psychiatry, so it was a lot of managing dementia, making sure medications weren't interacting with each other to make sure they weren't experiencing any sort of falls or sedation. The last 2 days I've seen schizophrenia, I've seen bipolar, major depression, anxiety, PTSD. We've had a couple of court orders for patients to come see us as a part of their rehabilitation. So I still, right now, I'm not super comfortable with what I'm actually supposed to be doing, which that is the life of a 3rd year and 4th year medical student most of the time. But because right now I'm still technically shadowing the psychiatrist. I'm in there with all the patients, I take my own notes, and then tomorrow, actually, my preceptor told me that she'd like me to practice doing my own notes and seeing if they were good, then she would use them as a part of her documents also. This preceptor has 2 templates that she uses only so far. It's one template for a psychiatric eval, which is a 75-minute visit, and one template for a medication overview or a medication review, and those are 15 to 30-minute long visits. She's so good at doing the structured exams that it just kind of flows through her chart effortlessly. So she has her own template and she just completely checks everything off the list. And the things she asks for are things like how's your energy been, how's your concentration been, weight loss, weight gain, appetite, sleep, anxiety, depression, side effects from medications, are they taking their medications regularly. Those are the highlights for a medication review visit, whereas a psychiatric evaluation visit involves more about going back to the root of the causes of their current psychiatric problems. So that can be as wide as what happened last year, what happened at work, what type of trauma did they experience, all the way to what happened to them as a child. So those visits are more varied and kind of more broad. Those can go pretty long. They're actually scheduled as 75 minutes, but they can go longer or they can be more brief. As far as my take on the way it is, I'm going to give you one preliminary day 2 pros and cons. Only one each though. One pro is that it's kind of a thinking specialty. So I know some people think like things like oncology and things like hematology, those are more like internal medicine too. Those are the specialties that are considered the less doing and the more thinking and planning and then doing. And I feel like psychiatry is a lot like that because it's a lot of problem solving. If you really enjoy problem solving, psychiatry can be really good for that personality type. I do enjoy problem solving, but I also enjoy working with my hands. I enjoy tests, I enjoy looking at imaging, scans, x-rays. I like to see physically what is wrong with patients that I see. So the pro is it's a thinking specialty. I enjoy that part of it, but the biggest con for me so far, day 2, the biggest con for me is the lack of involvement, at least on the provider's part, physically. I mean, that's one thing, I didn't mind about family medicine was that my preceptor would say, okay, what was wrong with her leg? Or prove to me that this hip pain was actually hip pain and not back pain. So I think in that respect, that would be a drawback for me if I were to do a psychiatry residency. But yeah, it's been interesting. I've definitely learned a lot in the last 2 days, and I will continue to learn a lot. But the biggest takeaways for me right now: learn your pharmacology, learn your inclusion and exclusion criteria for diagnoses. So, my psychiatry preceptor, she knows right away, oh, because they didn't experience these symptoms for this many weeks, then that's not this. Or, oh, they showed this, so that immediately rules in this disease. That's it, I guess. Hours are good. 7:30-ish, 8-ish to 2:30, 3 o'clock. So, not complaining about that. Gives me some time to head back and figure out all of these medications. So yeah, that's it. Day 2, Psychiatry First Impressions. Let me know what you think in the comments. I'll post a little blurb about this video on my Instagram. I'm Adam from C1Do1. Thanks for watching.